coronavirus vaccines will be safe and it will be effective, and that it could be here next month. But would you get it? Well, today we're getting your take as once again we've assembled some of our Fox 32 viewers for their instant reaction this morning. And we want to say good morning, first of all, to all of you this morning as you weigh in on this. Coronavirus deaths in the United States has passed 200,000, and now a lot of people are wondering just how long before a COVID-19 vaccination becomes available. And of course, the president making a very ambitious declaration last week that every American will get one by April if it's approved. But will Americans get one if and when that happens? So this morning we have invited the members on this panel here. They're weighing in on the topic of COVID-19. Dr. Christopher Kober, he is from the University of Illinois at Chicago. We have Marta LeBeau. She is retired and she is actually considering being part of the Moderna vaccine trial. And then there's Lee Baker, a marketing executive in Chicago. And finally, Christina Isherwood. She's a mom of 2 young children under the age of 6. Good morning to all of you. Thank you for coming on the show this morning. We appreciate it.
Good morning.
Thank you.
Well, Marta, let's start with you. You may actually be part of the Moderna vaccine trial. Tell us why you would put your life on the line like that to help Americans. Are you worried at all? Concerned for your safety?
Well, I think I was, but I've really looked into it. It's past the phase 1 trial, so it's been determined to be safe. It's not a live virus. It's not even a deactivated virus. It's a tiny a clip of genetic material from the virus. So I'm feeling okay with it, and I think it's a civic duty to participate in drug and vaccine trials. If people hadn't participated in the polio vaccine trial, we would have had a vaccine much later than we did. So I think that I feel good about it.
Yeah. First of all, how did you end up being part of this potential trial? Did they reach out to you? Did you reach out to them?
I heard that they were looking for older people, which was another reason why I was interested in it.
Oh, okay.
I think that vaccines and all drugs need to be studied on a wide assortment of people. And I thought to myself, I've always been kind of interested in doing this, and I thought, well, this is an opportunity.
Yeah. Well, Lee, let's talk to you right now because you're currently working from home because of COVID-19, and we know that this is a life-changing moment in our history for all of us. I want to ask you what your thoughts are on this vaccine. Are you somebody who's willing to take it?
I think given the kind of all of the recent announcements around the fact that it would be available mid to late next year, and then we keep bumping it up, and then now all of a sudden it's going to be available by the end of October, possibly. That obviously makes me a little more nervous.
Mm-hmm.
So I think most likely I would probably wait until next year. Obviously, post-election, it's turned into, or really since the beginning, it's been a very partisan issue. So, I don't want it to. I don't want to take it until we're certain that it's safe. And I think at the end of the day, I'm going to rely on the medical professionals and rely on the scientists and those people to tell me when it's safe to take it.
So so it sounds like you're kind of going to wait till other people take it, see how that goes, and then you'll make your decision?
Yeah, I think so. I mean, like I said, I'm going to rely on the medical community as opposed to the president. So
okay.
When that all is in alignment, then I'll be ready to take it.
All right, well, let's check in with Christina right now because you are a mother of 2 young children. And, we know there is a list of scheduled vaccinations that kids typically have to take in their young lives. So what are your thoughts on this? How do you feel about your children being vaccinated for COVID-19?
Well, first of all, my kids are up to all their vaccinations. I'm a firm believer in vaccinations for things like polio and smallpox and measles. But this one just scares me. From everything I've read, it typically takes 7 to 10 years to prove both efficacy and safety in a vaccine. And for me, the risk does not seem to match up with what my kids or myself would even be facing with COVID. The fatality rate, according to CDC, for children under the age of 18 is something like 0.003%. For people aged 20 to 49, it's 0.02%. So for me, that doesn't seem to marry with the risk of an untested and rushed and unproven vaccine.
Well, you have done your homework for sure. Let's talk to Dr. Colbert, who right now, doctor, 2/3 of Americans say that they will not be getting the first round of vaccines, even if one does become available. I mean, you're listening to some of the responses here right now this morning. So what is your view from inside the hospital?
Well, to be quite honest with you, this is a conversation that I have very often with patients from the vast few different point of references. We've made tremendous advances within the management of COVID-19, and I'm cautiously optimistic with the vaccination. However, I think the reality that we have to honestly address is the fact that it takes years for clinical trials. It takes time for clinical trials. And in fact, there's a lot of gratitude that goes to BARDA for participating after this phase of phase one. And it takes a process. It's not only just safety, it's efficacy in comparison as well. Again, I'm cautiously optimistic of where we're moving as a medical community and as a community in general toward addressing these concerns. I do believe that anything in November and December is a little bit too early at this time to really hang your hat on something that you want to give a large population without having the time to assess the longevity of safety. That being said, I do think, again, I'm cautiously optimistic, but the reality of clinical trials take time, and there's a reason they take time.
Yeah.
And we just need to be cognizant of that fact.
Well, clearly this is a medical issue, but there are those who feel the vaccine is being rushed, for political reasons. So I want to go to Christina right now. What are your thoughts on that as somebody who is from Chicago, a blue state, currently living in Florida, a red state?
I think that there is a lot of pressure to make people feel safe and make people feel like they can get back to life. But I don't know that it matters to me who's in the Oval Office. A vaccine for a new virus in under a year just doesn't sound safe to me, given, once again, those risks that my age group and my children's age group is facing versus the risk of an untested vaccine. Also, the vaccine, though, from everything I've read, is going to be more along the lines of the flu shot with maybe a 50% efficacy. So I don't necessarily see a point in pushing something through that is maybe going to give us a 50% shot at protecting people, when there's also a lot of other promising research out there with T-cell cross immunity. There's more and more studies showing that a lot of the population will already have that cross immunity thanks to other coronaviruses, such as the common cold. So for me, it's not about politics. It's about science, and it's about personal rights and your health and your body. And I don't think that anyone can convince me in the next year that this is safe for me or my children.
There are concerns that once a vaccination's in place, it's going to be forced on the public, almost like a public shaming, if you will. Like, in other words, you need to prove you're vaccinated before you are allowed to go back into work. That papers might be checked before you fly. That children may not be able to go to daycare or schools unless they can prove they've got this vaccination or documentation. So, doctor, I want to ask you, we know pediatricians, they have to sign off on these immunizations before kids are allowed to play sports or go to school. So could we possibly see this with adults in the workplace? What's your opinion on that?
That's a very common question I have as well, is the implementation of a vaccine. That's a hard sell to convince a community of individuals that this is a must-do for everyone. And I think that would add a little bit more anxiety to a management that could overall be something great. And I would caution any policy in reference to making anything out the gate mandatory for a large population. I don't see any accredited medical organization endorsing something like that. I believe with that would come, in fact, the evidence, the science, the conversation, the data to further support the use and when it is safe to use any vaccination.
Well, Marta, we know that you say you'd give it a go before it's released to the public, but what if you were pretty much forced or shamed into getting a vaccine? Do you think that would be right?
No, I don't think it's right. But I also have to think in terms of the fact that if I were an essential worker or a first responder and I was convinced that this was a safe vaccine, I think I'd be pretty happy to get it. But I think safety is really the issue. And if people feel that something was rushed to market, I think people are going to be very concerned and scared. and I understand that completely.
Well, Lee, if it meant going back to normal, because I know you're working at home right now, if it meant that you could go back into the workplace, but that would be required, would you do it?
No, I just don't agree with it. I just don't think that's fair to force it upon people. So I think that there should be, other options for people that don't want to get it, that don't feel safe getting it. Whether that is to continue to wear a mask. And I think through this whole thing, unfortunately, not everyone, believes this or abides by this, certainly. But I think that there's a level of social responsibility that people have to take. And, some do, some don't, certainly. But if you feel safe getting the vaccine, certainly that's your choice. If you don't feel safe, I think that's your choice as well. And you should take it upon yourself to be safe in other ways.
Okay, so one last final question. It's a yes or no answer. Let's start with you, Marta. Yes or no, will you be getting the coronavirus vaccine when it becomes available? I know your answer, but go ahead and say yes or no.
Well, yes and no. If I join this trial, yes, I will be. But as a person, just as a consumer, I would not get this vaccine unless I felt absolutely certain that it was safe.
Okay, Lee?
And if something rushed to market I would not have a lot of faith in.
Okay, Lee? Yes or no?
When the medical community and my own medical professionals in my life deem it safe, I would do it then.
Dr. Colbert?
When the medical evidence supports it, I would jump on board. But until that time, it's a hard pass.
Okay, Christina?
As of right now, you couldn't pay me to get it.
Okay, there is the answer right there. Hey, all of you, I want to thank you this morning for joining us to talk about this, weighing in on the vaccination issue. It is a hot topic, and again, people are still making their decisions, and you may have just influenced what people think. So thanks for giving us your opinion this morning.
Thank you.
Thanks for
Thank
having
you.
me on.